This month's safety topic is heat illness prevention, brought to you by Think Together. People suffer heat-related illnesses because the body's temperature control is overloaded. To prevent heat-related illness and fatalities, you should remember these 3 simple rules: water, rest, shade. Here are some ways to practice these rules to help you protect yourself from heat-related illnesses. Water. Drink water every 15 minutes, even if you're not thirsty. Rest. Rest in the shade to cool down for at least 5 minutes. Rest early. Do not wait until you feel sick to rest and cool down. Easy does it on your first days of work in the heat. You need to get used to it. If you're new to working in the heat or returning for more than a week off, and for all workers on the first day of a sudden heat wave, implement a schedule to get used to the heat gradually. Shade. When you can't be in a shaded area, make your own shade by wearing a hat and light-colored clothing. Keep an eye on fellow workers to look for symptoms of heat illness. Let's have a look at how common heat-related illnesses can be recognized and treated. There are 3 forms of heat disorder: mild, moderate, and severe. Heat cramps are often the earlier and least serious form of heat stress. It isn't dangerous unless the symptoms aren't treated. You should get treated and tell your supervisor. These signs and symptoms will help you recognize heat cramps: sweating a lot, having painful spasms in your muscle during activity or hours afterward, developing tiny red bumps on skin and prickling sensation, feeling irritable, dizzy, or weak. To recover from heat cramps, you need to rest in a cool, shady area. For muscle cramps, use warm, moist compresses, then massage gently. Drink water or sports drinks. To relieve rash, use a mild drying lotion. Keep your skin dry and clean. The next more serious form of heat stress is heat exhaustion. It should be treated right away. You may need to take a break from work and seek medical attention. These signs and symptoms will help you recognize a heat exhaustion: sweating a lot, cold, moist, pale, or flushed skin, feeling very weak or tired, headache, nausea, loss of appetite, vomiting, feeling dizzy, rapid or weak pulse. To recover from heat exhaustion, you need to rest in a cool, shady area. Drink water or sports drinks. In some cases, a medical professional will need to administer fluids. Use cool compresses on forehead, around neck, and under armpits. Seek air-conditioned environment. The last and most serious form of heat stress is heat stroke. It's a life-threatening medical emergency. If not treated right away, heat stroke can lead to permanent brain damage and even death. These signs and symptoms will help you recognize a heat exhaustion. Sweating stops. Hot, dry skin looks red, mottled, or bluish. Deep, fast breathing. Headache, nausea, or fainting. Rapid, weak, or irregular pulse. Feeling dizzy, confused, or delirious. Having convulsions. If you notice these symptoms, you should call 911 immediately. While waiting for doctors, rest in a cool, shady area. Have clothing soaked with cool water, or remove restricted clothing as appropriate. Seek air-conditioned environment. Drink water or sports drinks, unless the person is unconscious. Now you know how to recognize and treat different forms of heat stress. To prevent yourself from heat-related illnesses, always remember 3 simple words: water, rest, shade.